Hi and welcome back to the Friendly Vet channel on YouTube. Today we're going to be talking about quite a serious topic, so we're going to talk about what to do if your dog collapses. So the first thing that you want to do is at that moment get on the phone to the vets, because no matter what happens, even if your dog kind of comes round and stands up like nothing happened, they definitely need to be checked out by vets pretty soon after. So if there's two people, that's great. One of you can get on the phone while the other person is having a look at the dog, or if it's just you on your own, you can get the phone going, get it ringing while you're assessing your dog, and you can also relay that information that you get from looking at them to the person on the phone at the same time. So to make things easier when you're thinking about what you need to check, you can use the human little acronym that they use when someone collapses. So it's the ABC, which stands for airway, breathing and circulation. So, you know, we're not really that different from the dog, so obviously if they collapse it can be the same sort of things that have happened to them. So those are the three most important things that you need to check first. So to check your dog's airway, obviously examine their mouth, have a look inside the mouth. Are they choking on something? Is there anything obstructing the airway? Is there swelling inside the mouth or the throat? If you can feel the throat as well, make sure there's nothing abnormal there. And while you're down on that area as well, you can check your dog's gums and see what colour they are. You can get a lot of information from looking at the gums. You've probably noticed your vet will do that every time that your dog comes in. So just have a look, lift up the top lip and have a look at the gums. What colour are they? Are they a nice pink colour, sort of like a palish pink? Or are they getting a little bit too pale, like a really faded pink, almost white? Or are they a more sort of darker greyish, bluish colour? They could also be like a bright red colour or like a deep pink. Any of those things obviously not normal, and they can help your vet work out what's going on, so it's a good thing to notice what colour they are. You can also feel the temperature of the gums. Are they cold? Are they really hot? And also, are they moist? They should be quite slippery and like salivary to touch. If they're really dry and sticky, then that's not quite normal, so take a note of that as well. And so B stands for breathing. So you want to see, first of all, is your dog breathing at all? If they are breathing, are they breathing really fast? Are they breathing really slow? Is it shallow? Are they putting in more effort than normal? Are they making an abnormal noise? Are they coughing or wheezing or anything like that? Anything like that can, again, give some useful information, so take a note of that. If you're able to and you've got time, this is probably more if you've got more than one person available, you could actually time how many breaths your dog's doing in about 15 seconds, and that's quite useful to know as well. So then you get on to C, which is for circulation. So you want to check your dog's heart rate or pulse. So you can either do that by feeling their pulse on their leg, which I'll put in a picture of where to do that. It's a good idea to actually get used to checking your dog's pulse when they're feeling well and normal, so that you can get used to finding it. You can find it more quickly, and you can know what it's supposed to be like, so you can tell if it's feeling weaker than normal, for example. You can also feel your dog's heart directly. So if you feel around on the chest, it can be in a slightly different location depending on different dogs. You might have to go sort of more underneath the elbow on the front arm, or it might be a little bit further back on the ribs. If you've got a small dog, you can kind of do like a claw hand and hold both sides of the chest together to feel the heartbeat. And again, you could get used to doing this when your dog is well, so that you know how hard it normally beats and sort of an idea of how fast it normally goes. So even if you can't count it, you'll be able to tell whether it's going extra fast or whether it's going slow. Another way that you can check the circulation is to just have a look at the extremities. So feel their paws. Are they really cold? Are the pads in the paws paler than normal? and can they feel you touching their extremities as well, which is all good information to get. So that's sort of the main things with the ABC acronym, which hopefully will be easy for you to remember. You'll probably be panicking in that situation, so don't feel too hard on yourself if you don't remember every single piece of information to get. Some extra things that it's good to take note of is whether your dog is conscious or not. If you call their name or touch them, will they turn their eyes to look at you? Will they lift their head, or are they just kind of staring into space, not responding at all? It's also good to notice your dog's body posture and how their muscles are, what position they're in. Are they really stiff and tense? Are they kind of arching their back and going into a strange position? Are they doing any abnormal movements like twitching? Or are they having a seizure where their legs will kind of move as if they're running? And the last thing that you could take a note of as well is any bodily functions. For example, did they vomit shortly before or after when they collapsed? Did they pass any urine or faeces? And again, this is good information for your vet to know to try and figure out what's going on. So hopefully, even doing all that, it sounds like a lot of things, but it should only take you about 30 seconds perhaps to do all of that. And by that time, hopefully you've been able to get in touch with the vet, let them know that you're on the way. Probably just pick them up and just go straight away. There's no point in hanging around. It wouldn't really be safe to leave it, especially if some of these things that you've noticed are a little bit more abnormal, like if they're really cold, if their gums are white, if they're not conscious, etc., then you need to go to the vets immediately. But please do call them on the way, because it will be good for them to know that you're coming, first of all, and then secondly they can make sure they've got everything prepared for you, such as whether they need to get oxygen out, set a table up ready for your dog, whether they need to make sure a vet's available to see you as soon as you get there. It could be a better outcome for your dog if they know that you're coming and they know a few of these things that you figured out. So I hope you find this useful. I hope this doesn't happen to you, because obviously it's not going to be a very pleasant situation, but if it does, hopefully now you'll be more equipped to deal with it and get the best outcome for your dog. So that's it for everything that you need to do if your dog collapses. I hope that doesn't happen to you and your dog, because obviously it's not a very pleasant scenario for you. If it does, then I hope you're more equipped to deal with it, and if it does happen to you, just make sure to stay calm and, like I said, get them to the vets as soon as possible. Thank you so much for watching. If you enjoyed this video and you want to see more content like this, then feel free to subscribe to the channel, and we'll be back with more information on how you can best care for your pet and what to do in all different kinds of scenarios. Thanks for watching. Bye.